Hello. So for my mock role play discussion, I'm going to be talking about an 11-year-old girl named Sarah who is in 6th grade. She came to my office one day visibly upset. So I invited her in, asked her to have a seat. I thanked her for coming to see me and asked her what was going on and see what was bothering her. She started to explain that she's really struggling with her math and biology classes. She says she doesn't understand the work, and it's getting harder and harder. She understood it at the beginning because it was like what they did in middle school, but it's gotten harder and now she's struggling to keep up. So that's making her really anxious. And whenever she gets these anxious feelings during class, she just shuts down and doesn't complete her work. She says that when she starts feeling stressed and anxious, she just puts her head down and starts to cry, and then just doesn't do her work because she then has her head down for the rest of class normally. She says she cares so much about her grades, and in elementary school her grades were always mainly A's and maybe some B's here and there. So she says it makes her really upset when she's not able to finish her assignments because she knows it's going to affect her grades. I ask her if she asks her teacher for help or asks questions when she doesn't understand things so that she's able to complete her work. But she says she doesn't like asking questions because she doesn't want to look stupid in front of her friends. So she'd rather not ask. And now she feels like she's more behind than she should be. So she really doesn't want to ask questions now. She says she's noticed that her grades have been dropping in these classes and she doesn't know what to do. She also says that she struggles to do her homework in these classes because she's not understanding. So she knows that not doing her homework is also making her grades drop lower. I would explain to Sarah that I think she could benefit from a technique in behavior therapy, and explain to her that it would be a way to help her make changes in her behavior during these stressful and anxious situations. And I would ask her if she was willing to give it a try to see if it would help her whenever she gets these feelings during class. So she does agree to give it a try and asks what she would have to do to for this technique that I told her about. So I explained to Sarah that the first thing I would like her to try is something called the STOP acronym. So the S stands for stop or take a pause. So first I'll just explain the STOP acronym to Sarah. Then I would walk her through a sample. So stop or pause. The T stands for take a deep breath. O stands for observe. So observe how your body feels, your thoughts, feelings, emotions, or physical sensations, and then proceed. So with Sarah, I would walk through an example of her during class when she starts struggling with an assignment and she feels like she wants to shut down. I would explain that she could stop right then and take a pause and just take a deep breath. And I could go over different breathing exercises for her during these times if she just wants to close her eyes maybe and take 5 deep breaths. Then she could observe, think about what she could do in that situation to help herself be successful, or like in her situation, complete that assignment or test or whatever it may be, and then proceed. So that might be asking for help from her teacher, or if she's allowed to, asking a friend for help on the assignment that they're working on. And I explained to her that this is something she can also do at home when working on her homework, since her homework is also a stressful time for her when it comes to math and biology. And I asked Sarah if she thinks she would be able to try this, if she thinks it would be doable for her to try this STOP acronym during these stressful, anxious situations. And she does think that it could be helpful, so she does agree to give it a try, and thinks it will help her kind of push her to step out of her comfort zone and ask for help, because she knows that's what she needs to do now to be more successful in her math and biology class. So I encourage her that she can do it, just like she had the courage to come and see me and ask for help today. If she puts her mind to it, she can do it. I also explained to her that I think it would be beneficial for her to journal when she has these feelings and she uses the STOP acronym. So I would ask her to just jot a few things down about what she was feeling before she used the STOP acronym, and then what she did to overcome those feelings, and if she did maybe complete the assignment or homework assignment or test, and then how she felt after and how it helped her get through it. I would explain to Sarah that I would like her to try this for about a week, using the STOP acronym during these stressful, anxious feelings that she gets, and then journaling about it. And then after a week, we'll have a check-in meeting, and we can go over her journal and see if she's progressed and if it's helped her, if she's feeling any more confident in math and biology. But I will stress to Sarah that it's not going to be a quick fix. It may not be just 1 week of trying it, and then she's never going to feel that way again. It may be something that she has to do for quite some time to help her continue to not have these anxious, stressful feelings during when she's not understanding something during class. I think that Sarah would benefit by using the STOP acronym and then journaling about how it helped her, because it gives her the opportunity to, during those stressful times in class, to just stop. Instead of shutting down and putting her head down and crying and getting upset, she can just stop and take a deep breath and think about how she's in control of her behaviors, and she wants to be successful in class, so she's able to control what she does and take the steps to be successful. And I think that this would be a good thing to try with Sarah, because she was able to explain how she was feeling and when she gets these feelings, that she's aware of what situations trigger these feelings of anxiety and stress, and she knows that she wants to make a change. She is stuck on how to get there. So I think this would be a form of dialectical behavior therapy, also DBT, which a main goal for this therapy is to help provide clients with coping skills to manage negative situations and emotions on their own. So for Sarah's case, she has super negative emotions, and it seems like such a negative situation during her math and biology class, because she seemed to struggle so much and then shut down, and her grades were starting to drop. So this would be a good way for her to learn some coping skills to make the changes during those situations. When using behavior therapy techniques, we are helping clients increase personal choice and help create new conditions for learning. And behavior therapy focuses on the current problem and the factors influencing on them, not necessarily like problems from years ago or their family constellation or anything. So in this situation for Sarah, she was anxious about her in class, and it was nothing really from the past was bothering it. So this would be a good technique that would hopefully help Sarah move past and change her behaviors during these anxious and stressful times during her math and biology classes. Thank you.